Seattle and King County, and this is a news conference for faith leaders in our community. We're holding the news conference in a nearly empty room today, and that's because we're abiding by the recommendations to keep 6 feet apart, and we'll be talking a bit about social distancing today. We have members of the news media who are listening and watching. And after our speakers are finished, they'll be able to ask questions through a phone line. So reporters, you should have received instructions from the operator on how to signal that you would like to ask a question using *1. We're fortunate to have a sign language interpreter joining us as well. And before we get going, I'm going to invite Sharon Bogan of Public Health to step forward with an acknowledgement.
Thank you. So we would like to acknowledge that we are on the traditional land of the first people of Seattle, the Coast Salish people, past and present, and honor with gratitude the land itself.
So our plan today is we'll be hearing from our county executive, from the director of public health, Seattle and King County, and 4 representatives from faith communities here in the King County and Seattle area. We also have one of our speakers joining us by phone, and that is our first speaker, King County Executive Dow Constantine. And if all the technology here works just perfectly, he's ready now and will be joining us on the speakerphone. Mr. Constantine, it's all yours.
Well, thank you, and thank you for joining us today. Are we coming through loud and clear?
You are. Sounds good.
Excellent. Well, as you can tell, we're taking this social distancing directive very seriously. This week began with new guidelines and orders from us at King County and from Governor Inslee, guidelines and orders that have dramatically affected our way of life as we fight the outbreak of this virus. Our guidance from this Monday remains in place, and I want to thank all the restaurants and the other businesses that are complying and that are helping reduce the risk of infection to our residents. I know everyone joins me in my concern for those who have lost loved ones, for those who are ill, and also those who have lost work and income, and for those whose small businesses into which they've invested so much toil are at risk. These changes to our daily lives are difficult, but it's clear from the response so far that thousands and thousands of Washingtonians are heeding the call and are protecting themselves and protecting one another from infection. And in these difficult times, one place so many gather for comfort and for guidance are in places of worship, in our faith communities. But these are communities of people who are vulnerable to this virus. And right now, we have to join together to protect them in ways that are consistent with each faith tradition and that keep everyone healthy. That's why I'm so glad to be here today and to be here with our Director of Public Health, Patty Hayes. And in just a moment, she's going to introduce members of the faith community who are here to help their members continue to worship safely as we help flatten the curve and beat this outbreak. It is so gratifying that faith leaders have joined together to help in a community-wide effort, an effort to protect the members of each of their organizations, their faiths, their congregations, but also to protect the community broadly. This is truly a one King County and one Washington State effort. And your unique ability to communicate the best practices, the cautions, the admonitions, and to provide comfort to those who trust you, who trust you most, is going to be very critical to getting the public health message out and to thank you for the role that you've played, the critical role you've played in our efforts. Director Hayes.
Thank you so much, Executive Constantine. It's such a pleasure to be here. And I want to start by thanking the faith leaders that are here today. Thank you so much. You're stepping up in such incredible and important ways, as Executive Constantine just mentioned. And it's a real privilege to stand here with you. You know, these are unprecedented times. We've not had a pandemic for over 100 years. And we're all put in situations that cause extreme stress, trauma, and just the lack of feeling like you know what tomorrow will bring is so troubling to everyone in King County. Our community has been amazing, as the executive said, about stepping up to protect themselves and to protect their neighbors, to protect those around them. Many institutions are closed and people are asked to stay home, which is what we need at this time. But with that becomes more isolation and more trauma. Public health knows that that connection is one of the foundational elements of health and has been of grave concern to me every day. Social isolation can be such a lead to poor health. That is why in these times, so many of us turn to our faith leaders in our communities as sources of support, encouragement, words that can bring comfort. Faith leaders across King County are providing critical emotional support and finding ways to anchor key critical social services in a very stressful time. Your voices provide hope and unity to many throughout King County, and you're doing so while following the public health guidelines, which I so much appreciate. My gratitude overflows with the questions you ask us about how do I do this kind of service? How do I continue to make sure that we can do this that's so important for our community? Public health stands in solidarity with all of our faith leaders who are making changes to how they provide faith services. We are working to ensure that physical distancing can be implemented in the context of exercising traditional practices and faith practices. While many have had to cancel some of their services in order to practice this physical distancing, you will also hear about ways these leaders have found to stay connected to their community. Right now, staying home is an act of love for one's family, one's community, and indeed King County. We must take steps to protect the most vulnerable in our community from getting sick and preserve the healthcare system for those who need it most. We're extremely grateful for the support of these faith leaders, and they've provided us guidance as well so that we together can protect our community. We could not do this without them. I'll turn it back over to Keith.
Thank you, Director Hayes. Next up, we're going to hear from, if I can get the pages turned here. Good. We're going to hear from Nawishtamai Connor, who is the Housing Services Director for the Chief Seattle Club. Nawishtamai.
Okay, nestune taniku nawishtamai. Itamax kanotoni. Shakmaiski mianamu nawishtamai. I'm Yakima Blackfeet. I just said good morning and welcome. My name is Nawishtamai Connor. I'm the Housing Services Director over at Chief Seattle Club. One of the things that I've noticed, when this first came out was us meeting as a community. Like, what can we be doing for our people. Like, what do we see out there? Like, who does this affect? And when we think about that, we think about historical pandemics that happened to our communities and what they did in those instances and what we've heard from our ancestors. So we try to get ahead of this with our own traditional medicines, and we're still doing that today. You know, at the front door of Chief Seattle Club, we're still open. We still want our community to know that we're here for them, that we're worried about them, and we want to help them, and that they are a member of our family. So when we think about this, we think about, you know, bringing in traditional medicines to help heal this. At the door, you have to wash your hands to get in, and we'll ask them, you know, how are you feeling today? Have you been coughing? Do you have any symptoms? Do you need anything? Have you been around anybody who's had these symptoms of coronavirus? And it's really human focused when we're talking to people, because they are humans. Everybody that we're interacting with are humans. And when I think of that, I always think of like the traditional teas that we used to drink to heal us. And when this came out, the first thing I did was think about my grandmothers. What did they do? Like, what teas did they drink for sickness? Because this illness right now, it affects the elders. And, you know, at Chief Seattle Club, we meet on this daily. We talk about this daily, like what could we be doing differently? And right now, we're working with hotels to try and figure out our vulnerable elders, talking with them, you know, seeing what medically, that if they have any medical conditions, how can we help them? You know, where can we set them up? Do they need to be closer to their doctor? You know, all of those things so we can get them in there. And, you know, we've been blessed to have people who've donated to the cause so we could put people in hotels. And that was something I was doing this morning before I came here, was, you know, interacting with our community. And we're still trying to keep a social distance as well. So we're even in our lunchroom, we're putting the chairs away from each other and informing our community, like, you know, this is serious, and we need to wash our hands continuously. We need to watch out for each other and, you know, take care of each other. And that's the main thing. We have somebody from the community donating medicines that we can spray on our face that has pine and sage and all those medicines that we used to use that kills bacteria. So we're using those. We're using traditional teas. We're washing our hands on the front. We're doing social distancing, and we're also thinking about our homeless elders. We're thinking about our homeless families. We're connecting throughout the Native communities and all other communities, trying to figure out how we can help them, because the impact of this is, we think about the homeless population in the aspect of like, what could we be doing for them? Because you don't hear a lot about, you know, what's going to happen to the homeless community within this quarantine. And that's something that we've been impacted with, and we're trying to help with on a daily basis. And when I think about working with other cultures, other communities, you know, other spiritualities, I think as a community, it takes all of us coming together. It takes all of us listening to each other, asking each other, you know, is there anything you need? Because that's what community is. You know, I know we're all on a structured basis, but I think checking in with each other would help, because you go out to stores and things are sold out. You know, people are taking more than they need, and I think we need more community-based programs where we're going out to elders' homes and figuring out, you know, what do they need, checking in with people. And communication is the biggest key in all of this. And I just pray that each and every one of you are doing that we're taking care of each other through this process, because that's what it takes, is a community of caring for each other. Thank you.
Thank you. Next, we are going to hear from Imam Benjamin Shabazz of the Al-Islam Center of Seattle.
Thank you. Say Assalamu alaikum, which is the Muslim greeting of peace be upon you. And I want to give a special thanks to our hosts for this opportunity of bringing the faith communities together to share. One of the things that we try to do is to focus on our elders. And along with what the previous speaker talked about, this is a special concern because they're one of the most vulnerable. So we do phone contacts, going by, bringing them food, and giving them encouragement through speaking to them, a comforting word. Limiting public functions to the prescribed and mandatory levels. This has been an issue, especially in our community, the Muslim community, because community activities are very special, especially the Friday prayer service. And a lot of people were reluctant to give this up because this is the one time during the week that you see your brothers and sisters that you haven't seen all week. So as a Muslim, we try to give a reference to why we tell people the things that we tell them. And one of the common phrases that we always hear is believe in God, believe in Allah, but tie your camel. So where did this come from? Where did this ever come from? Well, there was a time when the believers would be so anxious to make their prayers on time. And when they would see the sun at a certain time or get around a gathering, they would just jump off their mounts and go run and make their prayer. Then they would come back and the camel would be gone. So our prophet, peace be upon him, told them, believe in Allah, but tie your camel. Now, this might seem rather simple, but the reality is that when the people would leave their camels untied, the camels would wander away, and sometimes the people would be left to die out in the desert. So it was a very serious issue, and the advice was very serious. There's a phrase in our Quran, our sacred book, that says, Inamal usri yusra, inamal yusri usra, which means surely after difficulty comes ease. Surely after difficulty comes ease. So we want everyone to understand that this too will pass. And so we don't want people to panic or get bent all out of shape. One of the things that we talked about this morning was about the social distancing and changing that language to physical distancing, because being separated socially from things that are familiar with you and your family and friends can cause you more trouble and actually reduce your immune system. So the language was changed to physical distancing. The other thing is that keeping everyone up to date with the latest information as we receive it, not only from TV, but from the internet. The other thing that we try to push is the importance of vitamin C intake. And the other thing, we talk about washing our hands. You know, if you handle money is some of the nastiest things you can handle because you don't know where it's been and you don't know who's been handling it. So if you have to deal with money, please make sure that you wash your hands. And also to be the best example ourselves personally so that we can show people that this is serious. And in closing, I'd like to say that just follow the golden rule. Do unto others as you would have them do unto you. That cuts across all religion, ideologies, and cultures. So I'm just passing on some of the things that we try to do to help our community. But this has also given us an opportunity for the faith communities to continue to work together. After this is gone and past, we can continue to work together and form a solid bond. Thank you very much.
Thank you. Next up, we're going to hear from Rabbi Rachel Nussbaum of the Cavanaugh Cooperative here in Seattle.
Thank you for inviting me to share a few words. As a rabbi here in Seattle, these last few weeks have been challenging ones, and I fear that the coming weeks may be even more challenging as the virus continues to spread, stretching both our healthcare system and also our economy. During this time, I have repeatedly drawn on the wisdom of my religious tradition in making decisions. There are two Jewish teachings that I would like to highlight here today. First, Jewish tradition famously teaches that saving a life, pikuach nefesh in Hebrew, is like saving a world. Preserving life is so important that it takes precedence over all the other commandments of our tradition. So, for instance, gathering for communal prayer, particularly on Shabbat, the Sabbath, is an important Jewish practice, but it can and should be put aside when lives are on the line. Second, Jewish tradition holds that we are all interconnected, part of the same oneness. An ancient story from the teachings of our rabbis illustrates this well. The story goes like this. A group of people were traveling on a boat. One of them took a drill and began to drill a hole under his seat. His companions said to him, "Why are you doing this?" Replied the man, "What concern is it of yours? Am I not drilling under my own place?" Said they to him, "But you will flood the boat for all of us." The moral of the story is clear. Regardless of who we are, where we live, or what we believe, we are all in the same boat right now. Our lives and our fates are bound up in one another. Judaism instructs us to rise above our individual concerns and to act in accordance with the collective good. So with these teachings in mind, I wrote the following in an email newsletter to my congregation last week. I said, our job as good citizens and as members of a faith community that cares deeply about the value of human life is to do what is being asked of us, which is to reduce physical contact dramatically in order to slow the spread of COVID-19. Doing so will give our doctors, nurses, and hospitals a fighting chance. Without a doubt, doing so will save countless lives. We know that there is no higher value than this. My community here in Seattle, Cavanaugh, has been trying to walk this walk. Over the past few weeks, we, like so many other congregations, both Jewish and from other faith traditions, have responded quickly to public health advisories in ways that are new and unprecedented for us. On March 9th, when we celebrated the Jewish holiday of Purim with a virtual gathering, it was our first such event ever. Since then, we have canceled all in-person gatherings and all in-person meetings. Kids' classes and senior groups have met online. We've emailed out videos of Sabbath services. We've held a parenting workshop by webinar, convened a virtual singing circle, and even a virtual board meeting. All staff is working from home. We are using phone and email to reach out to members of our community for pastoral care. Healthy members of our community are signing up to drop off care packages on the doorsteps of others who work on the front lines of our healthcare system or who are self-quarantining. While the call from public health is to maintain physical distance right now, as a religious community, we will strive to counteract the loneliness that could come from such an order by maintaining emotional closeness and spiritual closeness. We will need these deep connections to help us through the challenging days ahead. Thank you.
Thank you. And next up, we're going to hear from Reverend Dr. Kelly Brown of the Plymouth Church, Seattle United Church of Christ.
Good morning. Friends, this is an unprecedented time for us. And in response to the COVID-19 disease, Plymouth Church, Seattle UCC has been following closely the recommendations of King County Public Health Department, the City of Seattle, and the Washington State recommendations. Plymouth Church Seattle is promoting and implementing physical distancing, which has been proven to reduce and arrest the spread of the virus. As a church, we seek to set the tone for other churches. And we are a church that is a part of the epicenter nationally, so we believe it is important for us to do so. I believe that we should have an abundance of caution to engage with one another. And physical distancing, in my opinion, is faithful, compassionate, and doing good church. Doing so is lifting up the least among us and taking life seriously, valuing life above everything else. We can be community while also promoting safety. Science is not the enemy of religion or spirituality. In fact, it makes us smart and faithful. For the months of March and April, there will be no worship in person at Plymouth on Sundays. On Sundays, until we are told otherwise, worship will be held virtually and can be accessed online at plymouthchurchseattle.org. We are committed to be the church, and we have always known that the church has never been about brick and mortar, but about commitment to God and Jesus Christ, no matter the circumstances. We are scattered, and we are one. Love, compassion, and hope should be our common currency. Each of us must care for one another during this time by checking in on those who are elderly, who are differently and disabled, who are immune compromised, by phone or written correspondence. We're asking our members and others to be willing to run errands for those who are unable to go out at this time while taking care not to pass on infection or become a vector. Advocate safety measures for those who are incarcerated in our state and in our city, to include considering release for them. We're asking for safe housing for those who are unhoused and ways to clean. We are asking for compassion for those who are living in encampments, and compassion for artists, musicians, and others who rely on gigs to pay the rent and to live. We're asking to show compassion again for those medical professionals who are working overtime, putting themselves at risk to help us all. For retail workers and those at grocery stores who don't have sick time but care for us by being there. We're asking for you to lift up those who have no time off, for small business owners who have been impacted, and for all of those who are under the shadow of environmental racism and are at threat due to racist dog whistles. Through Zoom online platform, through YouTube, social media, Plymouth is continuing to be the church. We're worshiping together every Sunday, sharing daily words of encouragement with one another. We're watching movies together. Thank you, Netflix. We're reading children's books for our children online. We're even eating meals together. We're making masks with our sewing machines and by hand to deliver to the Children's Hospital and other places. So in the meantime, despite the anxiety of this virus and the fear that has happened as a result of it, we are responding as best we can, relying on the words from 2 Timothy that remind us, God has not given us the spirit of fear, but power and of love and a sound mind. Together we are saying, do not be afraid, but we're also saying that these are scary times. So if you are afraid, reach out, even if by phone, to assure someone that they are not alone. While we distance physically, may we be bound together, no matter our faith, and know that love is even our faith in these moments. Despite our faith, our identity, our orientation, or even because of these things, our ability, our cognitive and physical ability, our race and ethnicity, we can get through this, my friends. And when it's over, we will grieve together, we will hug one another, and we will close the distance. and weave together the tapestry of the beloved community. My folks used to say, trouble don't last always, and we will meet on the other side. So let us pray for those who are impacted by COVID-19, by those who have passed away as a result of it, and may God be with us all as we continue to watch things unfold.
Thank you. We're so fortunate here in King County to have leaders who can take public health guidance and rules and make it so meaningful and successful here in the community. So we greatly appreciate you. It is time now for us to take some questions, if there are any from the media who are on the line. Again, as a reminder, if you're on the line and you have a question, you can press *1 and you will be put into the queue. So operator, please go ahead and announce the first question. We don't have any questions in queue, I'm seeing. We'll give them a moment.
We do have a question in queue from Patrick Quinn with Como TV. Please proceed.
Patrick, you're on.
Hello, Patrick, your line is open. Yes, we can hear you now.
Is the county executive still in the room? Did he?
I'm sorry, no, the county executive was on the line and he is not with us at this moment.
Okay.
We'll give another moment or two for media to and for our technology being new to us to find out if there are any other questions. And
we do have another question from Mitchell Atencio from Sound Publishing. Please proceed.
Hi there. This is a general question for some of the faith leaders. I know that as you are a faith leader, there are things that you know and learn that your congregants may not know on a regular basis as far as, what practices are flexible, what things are in times of crisis. So I'm wondering if anyone would be willing to talk to how you're telling your congregants to take heart while they're not able to meet for things like prayer, for worship services, and how you're responding to maybe some of their concerns over things that they should be regularly, they would think of as mandatory.
any of us? Dr. Brown?
I'll share. I am grateful that most of our community is tech savvy, and so many of them have the best information. However, Plymouth is very privileged to have a staff which is a care team. So we have a community nurse who is sharing information all the time. We also have a care team that is involved and connected to our community by way of phone, by way of emails, sending out cards and correspondence. So we are consistently in contact with our community. We think it's very important that folks know that we are being flexible and we are building this plane as we fly. And so we want to make sure that they know they can be in touch with us and that there is someone there who will respond if there is a need. So basically, we are trying to do our best to maintain community by way of the gifts of telephone and online platforms so that we can share the best information and to let them know that we are praying together. As I said, I am offering words of encouragement and other clergy folks from our church daily so that we can be in touch and they know that there's an opportunity for them to remain the body of God together.
Thank you. I think we have another question in queue, operator.
Yes, we do have another question from Hannah Scott from Kira Radio. Please proceed.
Thank you. For all of the faith leaders there, we've heard reports coming out of some other countries about some religious practices that in other nations have perhaps led to an increase of coronavirus spread, and the concern locally and nationally about any kind of backlash about that. Can anyone speak everyone in our community as to what you're doing to make sure to kind of have that line between making sure that your congregation gets what they need, but also protecting public space at the same time.
Anyone